I am so proud of working for an organization that is not only at the forefront of health, but also is so concerned about the welfare of people all over the world.
We've improved health outcomes by making products available where and when people needed them.
It's really bringing people together for joint problem solving, using data, building relationships, all these things we love to do in public health. And so important to build bridges across communities and individuals to work together.
Just being a part of an organization that does such important work around the world to better the lives of so many people.
The ability that we've had to really work with and in a variety of countries to help improve their health programs, particularly for immunization.
In those very remote areas where they have nothing and all of a sudden there's a health facility and they can go there and they can get treatment.
I'm proud of the work we do at World Aid in Ghana, especially the current project that is helping some 11,000 highly marginalized girls go to school or go to the field of work.
I worked with community health workers in rural Zambia to help them learn how to use life-saving family planning. The best thing about it was to see the women themselves become so empowered about their ability to give back to their communities. I will never forget that experience, and it stays with me to this day.
The work I'm most proud of is the trip I did for UNFPA to the Rohingya refugee camps about 3 years ago. It was incredibly rewarding and challenging technical work for me to apply what I know in development to a humanitarian setting.
The most thing that I like about my job is helping adolescent girls and young women to access healthy services, as well as know more about gender-based violence. In Malawi, girls are victims of GBV and they fail to access family planning methods. So to make them access the services is a good thing for me because I know we're building a better nation.
I am most proud of the work that I did and JSI did in Zambia, where we, with our interventions, I think we truly saved thousands and thousands of lives. We went into their no system, supply chain system, and we put it in record time.
I'm proud of working with JSI because JSI has given me an opportunity to work with adolescent girls in northern Uganda. Particularly, I'm proud of last year where JSI served 99,000 girls with HIV prevention services, which represents 44% of the adolescent girls who receive DREAM services in Uganda.
Most recently, super excited and proud about our assessment in Palestine, looking at their ELMIS system and proposing interventions to improve data availability and use to strengthen their health system in Palestine.
In the last 7 years, we have supported the government to develop disability inclusive policies.
I have been extremely proud over the past 8 years to work on a project to help people with HIV in the US enroll in health insurance coverage under the Affordable Care Act, many who are getting coverage for the very first time.
I'm very proud of this endemic approach we're taking to our domestic HIV efforts, really working to address the overlapping epidemics of HIV, STIs, hepatitis, and drug use.
I think in Botswana, we are all so proud of the difference we've made in so many vulnerable children and families' lives as they've battled the HIV pandemic across sub-Saharan Africa. We can see the changes in people's lives on an incremental basis and even sometimes a dramatic basis, sort of week to week, month to month. And that is something that all keeps us going.
I'm so proud to have worked with USAID Deliver an SMS project back then, where we helped to increase the uptake of antiretrovirals and save countless lives for people living with HIV/AIDS. And currently working with eSupply, we are helping the government of Tanzania, we're helping healthcare workers to use supply chain data to solve their own challenges and improve commodity availability, where in turn it helps to improve the health outcomes of our fellow Tanzanians.
A proud moment for many of us at JSI is when we were awarded a special project of national significance from the HRSA HIV/AIDS Bureau, strengthening systems of care for people with HIV and opioid use disorder. This project is emblematic of JSI's approach, bringing together talented, committed, passionate staff with expertise in different areas and collaborating with local public health partners to identify new ways to improve how care is delivered for people living with HIV and opioid use disorder.
I find fulfillment waking up in the morning knowing that the work that we do is serving the lives of children, especially the children who are living with HIV.
Over this 20 years and more, we've seen HIV outcomes get so much better here in the Commonwealth. And that is something that's so very rewarding.
I had so much fun working on the DC office move and have really enjoyed connecting with JSI and WorldEd staff across offices and divisions around the rollout and support of operation systems like Replicon and Concur.
We have been able to lift up student voices, and that has given teachers in the US a chance to address racial equity in the classroom in a way that they wouldn't have otherwise been able to do.
I work for the USAID Cure Tuberculosis Project in the Kyrgyz Republic. This project is an opportunity for me to introduce new tools and approach to change the behavior of people affected by TB and communities. We work to reduce stigma and discrimination and mobilize communities to better detect and treat TB.
One of the things I'm most proud of was being at a press conference with the mayor of San Francisco as she announced our research on homelessness and behavioral health in San Francisco, and also announced funding that had been raised to support recommendations that we made in our report. And just knowing that the work that we were able to do at JSI was actually impacting the lives of people experiencing homelessness who had behavioral health needs in San Francisco.
Over the last 11 or 12 years, we have played an active role in researching, influencing, implementing, and evaluating a number of different policies in California's Medi-Cal program, which ensures over 13 million low-income Californians.
One I'm most proud of recently was a work group we facilitated in Denver among many service providers addressing food security. The work group came together right around the time the COVID pandemic was happening, and there was a lot of need in this area, but being part of a community and the opportunity to nurture the trust and collaboration in support of this work group's goals was really meaningful.
One of the projects that makes me most proud is our national life jacket observation study sponsored by the Coast Guard. We've done that study for 23 straight years. As from a public health perspective, the data that JSI has collected and written about demonstrates the effectiveness of mandatory regulations, and these data have changed the boating community's perspective on the value of that approach.
My greatest satisfaction from my work was in reframing these projects and understanding the essence of these very meaningful projects and being able to translate that into data for use for advocacy going forward.
I'm so proud to work on the USAID's flagship activity, which works to benefit more than 54 million people.
What I'm most about my work is the way we track the services we provide to our beneficiaries and APA.
I'm proudest of joining JSI to launch its new initiative in aging. There's so much synergy with other important JSI work.
We've helped support early grade reading programs across the years, reaching over 4,000 schools, procuring over 5 million teaching and learning materials for classrooms, for teachers, students, community members.
I'm so proud to have worked on the STAGE project where we reached some 18,000 marginalized girls with education, both formal and non-formal. As a male officer, after traveling many hours on very deplorable roads, where you get into the community and you finally get to meet a beneficiary who says, "Thank you for the work that you've done."
We are proud to be building a cross-division global center that is recognized for its commitment to digital equity and its leadership in leveraging technology to expand the reach and impact of education initiatives.
I got to follow a passion to do something meaningful about substance use disorders, primarily among young people, but really grew to a passion for all people and all aspects of life.
What I'm most proud of is the M&E capacity JSI helped to build all over the world.
While I've worked on hundreds of projects, I'm most proud of the Quality Improvement and Project Management Initiative I launched to help JSI learn from our projects, experience, and apply what we learned to grow and improve our work.
I love to interact with our beneficiaries, the HYW, the children and their caregivers, learning about their experiences with our project, getting to know about the changes that are happening in their lives as a result of our interventions.
World education in Botswana are not big, but our impact is. I am grateful to have had the opportunity to work here and to grow here, and I'm very proud to have been a small part of all that we have achieved together.
I've been so proud to be able to help women tell their stories. From family planning providers in the Blackfeet Reservation of Montana, to teachers in rural Mozambique who now have the skills and the tools to more effectively teach their students, to women in rural communities in Ethiopia who now have agency in their communities because they become community health workers.
What I like the most about working with JSI is the opportunity to work in the field and help pilot new innovative approaches here.
Being able to see change in the community, seeing that the children are growing to their best of their capabilities despite the challenges that they might be facing.
The thing I'm most proud of is the large number of people's lives I've touched in my work in doing capacity development work, and the helping people find their potential and know that the work they are doing in their countries is worthwhile.
Being part of the team that is contributing to the well-being of the vulnerable, I think that's something that I find fulfilling, and that I'm contributing to changing the lives of the children that are vulnerable.
Working for the upliftment of the lives of orphans and vulnerable children, the adolescent girls and young women that we work with on the program, and the communities that we are serving.
We are proud to have supported diverse organizations both before and during the COVID pandemic.
I'm happy to see the fruits of our labor. I'm so proud of what we do in the communities.
The impact we are doing to our beneficiaries, especially uplifting their lives, economically, psychologically, that will bring smile to our beneficiaries.
I believe that my contribution to World Education's work creates tangible change in the lives of many persons with disabilities and their families.
Making a difference in girls' lives through education has been the driving force.
And it's just an honor to be able to help people make healthy decisions and have access to services and resources that empower them to live the lives that they choose to live.
I believe that JSI is committed to trying to improve inequities around the world wherever they see it, including the United States. And so I'm proud of working with people who are on that side of history.
Give us any public health problem, and we are able to pull together expert colleagues with a deep knowledge of community needs, a commitment to health equity and social justice, and technical expertise ranging from healthcare policy to implementation science to clinical and social service delivery.